Well, you touched on, you mentioned that every optometry practice has a retail aspect to their business. And I know that in your practice, you provide patients with glasses and contact lenses.
Yep.
And years ago, I had contacts, so I've had both glasses and lenses. And I know that when it was me in that situation, I had a number of questions about, the pros and cons of contacts versus glasses. So I'm
Yep.
sure this is a conversation that you've had many, many times. So just wondering if you could just share with us, like, what are some of the
Yeah.
frequently asked questions that you get when people are sort of considering that choice between glasses or contact lenses?
I guess some of the myths that I come across on a regular basis are, and these are some of the excuses that I get given is, oh, I'm too old for contact lenses. I couldn't do them. And that's
Mm,
crazy. I've fitted new contact lenses to a new patient in her 90s. So yeah, if she can do it, well, anyone can do it. I've done contact lenses to newborns, where we get the parents involved in the care of contact lenses. So I don't think age is a factor. That's the first falsehood. Second is, oh, I couldn't possibly touch my eyes. And this is often coming from ladies with beautifully impeccable makeup. Yeah, you can. You're doing great with your makeup. You're getting right on the lashes with the mascara. You're doing the eyeliner. You're doing all of that foundation and other eyeshadows. You're doing a really good job. So you're used to going close to your eye. What happens when you get a bit of makeup in your eye? You clean it out, don't you? And you get an eyelash in the eye. You clean it out. So you're doing this already. This is just a new skill that we need to teach you. So it's about broadening your skill base. So again, not being able to do something is really a bit of a falsehood. It's a bit of a myth. There's absolutely we can teach people how to put contact lenses in and out. And it may not take one training session. Sometimes it might take two training sessions or three training sessions, but we'll get there.
mm,
Um, the advantages and disadvantages of glasses and contact lenses depends on what you're wanting them for. If you're wanting to throw away your glasses and never wear them again and only wear contact lenses, that's a more challenging pathway. It's doable, but not every contact lens can do everything.
mm, mm,
Okay. So some contact lenses can, but they are more specialty, more niche. Most contact lenses give us something that's pretty good vision, which might be ideal for certain settings. Like for me, I wear glasses. I've got them on at the moment. Um, I wear contact lenses as well, and I wear them using a system called monovision, where I've got one eye that's slightly better for distance and one eye that's slightly better for reading. And they're great for reading menus. They're great for reading measuring tape. They're great for climbing ladders in my house, doing odd jobs or building structures in my yard. And I really enjoy wearing them. So I wear them on weekends and I wear them socially and I wear them if I go out for my wife um, to see the movies or to go and have lunch. And I can read menus and I can do all of those things and not have to worry about my glasses and not have to worry about rain getting on my specs. There's some huge advantages of them. I don't get quite as good a close vision with them, but I've chosen to set them up that way so they'll be great for all of the things that I want to do. So I've chosen to have them with slightly better middle vision where I'm using my hands when I'm working in the yard and that sort of stuff. And they work really well with all of that. If I make them so that I'm really good for reading, um, then I don't do as well in the yard. And that's where I want to wear my contact lenses. So I've set my contact lenses up that are specially designed and powered um, to try and do the job that I'm wanting them to do. So first thing I ask patients is, what do you want them for? Do you want them for playing netball? Do you want them for playing soccer? Do you want them for umpiring? Do you want them for social? Do you want to wear them at work? And each one of those things would determine a different pathway of a different sort of contact lens. And it's about finding the right product to fit your requirements. I think that's probably the biggest thing, because with some types of multifocal contact lenses that we've got, because I wear multifocal glasses, we talk about vision good, not vision perfect. So
mm,
we want
mm,
vision that's pretty good to do a variety of tasks, which means
mm.
that opens up doorways and makes things enjoyable. Not necessarily vision perfect, because vision perfect doesn't always come with certain designs of contact lenses. So it's about a matter of a little bit of brain adaptation, which sometimes takes a bit more challenge. It's a bit more of a challenge for some brains than others. And certainly I've worn multifocal contact lenses and they were great for nearly everything, but they weren't good for everything. So
Mm.
for me, I really like what I've got set up for myself. It works for me. And sometimes we do that with patients. We might try multifocal contact lenses. We might try monovision contact lenses. We'll get to a happy place eventually. And if someone's got dry eyes, there are specialty contact lenses that make dry eyes much more comfortable, and make things less drying on the eye so your eye doesn't rebel against the contact lenses. And that's key as well. because a lot of people drop out of wearing contact lenses from eye dryness, and I certainly know I did even back in my 20s. I gave up. But the lenses we've got now are different to the lenses that were around 10 years ago, 20 years ago.
Okay.
The technology and the R&D that's gone into these things is off the chart. It's just amazing.